Okay. All right. So again, thank you for your patience on that bit of a delay. So let me tell you about the process for tonight. So I have some information I want to share with you that is I presented at the board meeting, but some updates to that. And then Assistant Superintendent Mazzara and Coordinator Wayhall are going to present the COVID safety plan for your perusal, your questions, and your feedback. And then after that, and feel free to put questions in the Q&A all throughout this. Depending on how long all of that takes, then we hope we can take some live questions. So bringing over into the panelist section for some questions or feedback that you may have. So that's going to be the process for tonight. Who you see on the panel here tonight, if you all can maybe change your names and put your titles behind it, that would be great. But what we have are the cabinet is here, and we have our directors here. My assistant, Dina Flores, is here, and our communications coordinator, Beth Burke, is here. So those are all the wonderful staff that are here to help address any questions you might have and to hear your feedback as well. And thank you, Elizabeth Ramirez, for your patience in getting this set up. And here we go. So last board meeting on Wednesday, I was able to, during my report, present information about the Governor's Safe Plan for All, as well as the other AB 10, all the other parameters that we have around opening school for in-person instruction. I really want to emphasize again that when we talked about SRCS hybrid in-person instruction and being ready for that instruction as of March 1st, it does not mean that is the day that you will be coming back to school. Because the reality is where we are with COVID-19, where we are with the testing situation, where we are, as I learned today, around vaccinations, having people come back, the general population or the phased in of the KA through 3 March 1st, I don't see a way that that timeline is going to be met, not from our doing, okay, but from all of the things that are out of our control, which is the virus, the testing situation, and the vaccines. It does not mean, though, that we are not going to continue to push to be ready to open on March 1st, right? I want to make that distinction because I think there's some confusion about that being ready and actually coming in are the same. In this situation, they are not. They are not. So let me start with sharing my screen. Oops. Adina, can you allow me to share, please? So when we talked about coming back in person for in-person instruction, really what set some of this in motion was the Governor's Safe Plan for All. I want us all to remember that that is a proposal. That is a proposal that the governor has put out, but it has to be funded by the legislature. The legislature met for the first time today regarding the proposal. They did not approve the budget today. And it appears that there's going to be much more dialogue and going back to the drawing board on this plan. The legislature has many, many questions, including the timeline. The timeline is a very aggressive timeline that the legislature does not feel is doable for schools in the situation, especially schools who have been in the purple tier and have never ever been able to get out of the purple tier. And I would say for our county that our surge rate, the numbers that we have, the cases that we have, are also a huge indicator that there's some things that have to be put in place before we can bring kids back onto campus for in-person instruction. So, and what I'm hearing from both parents and both teachers, that's an understanding. There are some that are confused, and I really wanted to clear that up today. Another thing I wanted to talk about before I get my screen share is that I don't know if anybody else had the opportunity to listen to President Biden's speeches and the speeches that were a part of the day. I think the biggest theme that came away for me was the idea that working together is going to get us to where we need to go. And I'm going to say the same thing about this. And I'm going to ask all of us, teachers, parents, staff, all of us. We all want the same thing. We want our students back in school. We want our staff back at school to teach those students. We all want them to come back in a safe manner, in a safe environment. I would ask all of us to please understand everybody's positive intent in their actions and in their words. And let's, if there is misunderstanding, let's come together and find out where the misunderstanding is. As we move forward, because it's not going to get easier, folks, it's going to get tougher. You heard President Biden talk about the vaccine distribution. Well, guess what? There are no vaccines in the storehouses in the federal government. This is really going to create a push later on the schedule for vaccines to even be able to come out. I mean, we're talking, differences, weeks differences now. We are awaiting the FDA to approve the process that Curative, the place that we had a contract for surveillance testing. At the same time, we're working with Valencia to try to get them aboard, but that's not going to be a fast process because everybody in California is trying to get them to do surveillance testing. So again, there are things that we have to put into place that are beyond our control. It's not within the parents' control. It's not within my control. It's not within the teacher's control. And so please understand that as we work towards getting ready by March 1st, and then waiting to see how we can get these other pieces in place so we can get our kids and our staff back into in-person instruction. So let me share my screen. Last Wednesday, I showed this slide. Can you see this okay, guys? Okay, thank you. I'm going to keep it in the non-presentation mode because I'm just going to show a few of the screens, but I am going to make it a little bit bigger. So what I talked about, and I got to move you guys over here because I'm talking over there, the in-person instruction. And so SRCS, once again, I'm going to say this about 25 times tonight so that it's very clear when everybody leaves here. It is about being ready to open March 1st, but in-person instruction will not begin until either the state and county case threshold is met, the governor's plan is put into effect as a law. I'm not sure what's going to happen with that, but it's definitely going to be a threshold that's going to be set to deem it ready for us to come back. And I heard today that the SAFE plan for all approval is not likely to happen in this month. So it's actually going to probably be pushed into February. All right. So what I'm hoping is all deadlines move forward, but more to come on that. As a reminder, when all of the things are met, all of the thresholds are met, the plan is approved, after March 1st, the first wave, what we're hoping to do is bring in preschool through 3rd grade and 12th through special education, pre through 12th grade, special education, English learners, foster youth, and homeless, what we call our vulnerable population. 2 weeks after that, after the first wave, the second wave will be the 4th through 6th graders. Okay. And then the 3rd wave would be 7th through 12th graders. However, the governor's plan does say specifically that 7th through 12th graders cannot be in person in the purple tier. They are also silent on the way in which we're going to handle cohorts at the secondary level because they're not recommending more than one cohort. Teaching and Learning has come up with some ideas and some thoughts around it that we will be presenting. So be prepared to provide some feedback on that to be able to bring back 7 through 12 when it's safe to do so. Okay. And then the second slide I wanted to show you, I also showed this on Wednesday. And on Wednesday, I told the community there, the people there, that we are going to go with the AABB cohort, which is the cohort that students are currently in. This was after much work from Director Dillon and Director Haley, getting feedback from parents, from teachers. So we are going to go with the AABB cohort learning plan. It is also the one that we've already negotiated with SRTA. And so that helps because it moves things along a little bit faster. Again, also the principals, the directors are working to develop the in-person cohorts. So asking questions about which students are going to come back, which students are not, and that's this data that they've gathered. So we have exactly to date how many students are going to come in person and how many students want to stay in remote. And as you can see, it's a little over 30%. And so what we're doing now is thinking about staff, working with principals about staff who want to stay in remote learning and those that want to come into in-person, and then seeing where the gaps are and working to fill those gaps. Okay. Oops, sorry. I have my trusty mouse. Negotiations will begin with SRTA tomorrow on the MOU. CSEA MOU, it's actually good the way it is, the way it was written in the original. And so we at this time don't need to go back to negotiate the CSEA MOU, but the SRTA MOU will begin the discussion tomorrow. As I said, staffing to accommodate, now that we have an idea of who wants to, which parents or which students are going to be in remote and which are not. Again, I want to emphasize this about the cohorts, that the cohorts are limited to 12 students in K through 3, 16, 4 through 6, and 16, 7 through 12. But remember, see the next line, 35% of our students are choosing to stay in distance learning. This brings our preschool K-3 down to about 8 students, and our 4 through 12 down to about 11 students. So I feel pretty comfortable with those kinds of spacing, that kind of social distancing in our cohorts. We have begun training, particularly our CSEA staff, and we'll continue on with our certificated staff as it relates to health and safety protocols. Tonight, you will be getting a view and a chance to give feedback to the Cal OSHA COVID Protection Plan, or the CPP. The COVID safety plan is a combination of that Cal OSHA plan and the school checklist, and you're going to take a look at the checklist tonight as well. As I said, the funding for the Governor's Safe School for All is February 1st for the greater amount, which totals about $6.7 million for our district. If we apply for March 1st, it's $377, I believe, per student in ADA, and so then it's about 4-point-something million, so about a $2 million less. And then the dashboard, it did go live, and we are reaching out, if we may have already done it, to SRTA to work together on the dashboard so that we can come to agreement and shared understanding about the numbers and how the numbers are calculated in terms of the number of cases. Extended summer, there's been more work done by the legislature. It looks like we're going to get some really, hopefully, nice funding for an extended summer program. Both I'm looking at this summer and the summer following, so that we can really extend learning opportunities for our students. And then finally, the return to school plan. I had planned to bring it back to the January 27th meeting, but the information I received today on the vaccinations and the testing information, I'm going to have to bring it back in February. I still am going to have an item at the board meeting for an update, kind of what I'm doing with you right now, I'm going to do with the board, and provide an opportunity for more comment and feedback, not only from the board, but also from the public. Yeah, we have to get, I want to get more information. There could be something that breaks in the next day or two from the legislature, from the governor's office. And so I'm going to try to go to the very last minute of the board agenda update on this. Yeah, so that's where we are. Okay, at this time, I'm going to turn it over to Assistant Superintendent Mazzara. I'm going to stop sharing. Actually, before I turn it over to him, I see people are putting questions in, so okay, that's good. Let's just keep putting your questions in there, and then we'll have an opportunity more at the end. But let me ask this: do staff and teachers need to get both vaccines to return to school? To return to school, it's not mandatory. The vaccines are not mandatory. This is really up to you to get the vaccine. You need to get both vaccines and wait 2 weeks for it to be effective. So I do want you to know, if you haven't heard that information, you get both vaccines and then you wait 2 weeks, and then you're supposed to be protected at that point. Okay, all right. Assistant Superintendent Mazzara.
Thank you very much, and good evening, everybody. I'm going to share my screen now and do a brief presentation on, I lost this. There we go. Do a brief presentation on what we're required to do to begin the process to get the governor's money behind the early part of the plan, if, as Dr. Kitamura said, that were to be approved. And part of that is a review of regulations that are put up by Cal OSHA. Cal OSHA regulates employers. So in the area of education, we have to develop a plan for our employees. So I want to distinguish that, because that's not our return to school. Employee safety is a subset of our return to school plan. This is simply just about what Cal OSHA requires. So this is not a comprehensive document that really releases all that information. As I'm doing this, Caitlin Wayhall, who was introduced earlier as our COVID coordinator, is going to put into the chat a document that's called our CPP. And for those of you that are able to, you can follow along with us and kind of look at that document, and I'll walk through it here in a moment. So this plan is just recently established by the governor and the Cal OSHA legislature, excuse me. And it is into effect now, provided that we have to supply our information. We took this previously to the board as an addendum on December 14th, when we had our return to school 2.0. But we've had to do a couple of tweaks with it, because as Dr. Kitamura mentioned, the governor has since come out with further guidance. And every time we come out with new guidance, there's some tweaks and zigzagging we have to do. But what this document is in essence a combination of what we've done for a number of months. Since the summer, when we began meeting both with our employee organizations, with other members of the public and committees that you all may have been a part of, we've been gathering this information for a long time. We just now are just simply putting this previous information together in our CPP. So I'm going to show you the CPP here in a moment, and to kind of let you know that it's a combination of this. And then there's a checklist that we'll walk you through next. So in the document that you might have in the chat link, if you're following that, is we have to go through what our employee safety plan is about. And these, as you know, these are regulations and links and all the things that we're required to follow. The first part of the plan requires employers to look at and identify evaluations of hazards. So we in Santa Rosa City Schools, we have a number of ways that we evaluate the hazards. We have a communication chain, both anonymously and as just reporting through our normal, like school work, school-based hazard problems. Something goes on at school, we have a normal system in our maintenance operations to report problems. So we already meet this because we're participating in an ongoing way to receive information from employees. This talks about our employee participation plan. We mentioned our unions will be participating. And one of the things we have to do under the employee side of it is employee screening. So currently we are doing employee screening. Anyone that comes onto our campus is asked to do a self-check of the symptoms. They have thermometers. And if you have any students that are coming into our daily support care, we are checking students as they get dropped off, many times in a car, asking them the self-check guidance questions. But We're moving forward to a kind of like an electronic screener. We have an app, Parent Square, that you may be familiar with. And within that, there's a way for us to do a daily screener. So we're working through that as employee screenings. And as we go forward, we're going to move forward to change from requiring screening when you come off, like a physical screening, to a self-screen for both employees and later with students. I mentioned previously our communication. We have to have a way to correct hazards that are found. We have a complaint form and a complaint process. Again, that could be anonymous or by name. And Caitlin and her department have people to come out and investigate complaints to try to find out if that is or happening. And we've had complaints of employees not wearing their masks as they're supposed to when they come across. We have a progressive level of consequence that we work with people on that, and we address that, and we make sure that people are following our district protocols. Physical distancing in our controlling of hazards. As you know, we have published, like anywhere in the state, we've published our 6 feet distance. And so, we have worked with our staff to make sure we try to keep 6 feet apart. Even if we're 6 feet, we're wearing masks anywhere we're around on our campuses. We try to create an environment where you can keep mask off if you're in the confines of a closed office. But when you're in any other kind of setting, it's primarily being masked. And so our staff know that. There's a point here about training, and that's part of our plan that we have to make sure we explain all that. Face coverings, we've done the same thing you've heard in the county. There are certain approved face coverings. We provide for any staff member that needs it, face coverings like the surgical masks. But as you all know, many people are bringing their own. We do not approve of the bandanas, the single layer, those other things that have not been scientifically proven to really stop or halt the spread of vaporization of the virus. And so we want to make sure that people are masked up appropriately. Engineering controls, let's talk about ventilation. So we have prepared increased ventilation in our school sites. We have HEPA filters that we've provided already to our existing school sites. And as we bring small cohorts back, and as we talk about our in-person readiness, we will have additional filtration from our existing systems. We also have HEPA filters that'll be available at the classroom level or the office level. You all are probably very familiar with cleaning and disinfectant rules. And again, this is not about students, this is about employees. We have hand washing available, hand sanitizer available. We already walked through a regimen of disinfecting our bathrooms throughout the day. Those are all things that we've developed into our plan. Our PPE, we mentioned before about face masks. We have shields, of course, for either employees that aren't able to wear a mask, either don't want to wear a mask. We already have face shields that are available. I mentioned the hand sanitizer and the alcohol content. And our PPE. I already talked about investigating and responding. That's all part of our prevention plan. We work for Cal OSHA here. We work with our COVID coordinator who is in contact with her nurses, our school nurses, or an LVN that work with her directly. And we follow up these cases and we identify what happened and what could have been prevented or changed if there in fact was something that wasn't working correctly. I already mentioned about our ability for communicating. We have in our trainings to employees, we talk about communicating, fear of non-reprisal. We want to make sure everyone knows that we need to hear about those things. We've had instances where employees have come expressed with symptoms, and we want to make sure our communication is clear that employees are not to have come to work with symptoms. They are not penalized for staying home, either through the leaves from the federal government or our own leaves. We want our employees to make sure to keep our school system, our school environment safe, that they are not to bring themselves to school if they have any symptoms, and we communicate that as much as we can. We've already had a training and instruction. We've had 3 trainings for primarily our classified staff. We're beginning to increase that for our certificated staff. And that is just around what these protocols are, how to communicate with your HR department if you do have a symptom, what we're looking for if we're doing contact tracing. That's down here that we have to have a system for contact tracing. Contact tracing, remember, is us making phone calls and talking to employees about who you may have come in contact with if they had a positive coronavirus test. Exclusions, we have the same quarantine rules. We have a 14 and a 10-day quarantine rule depending on circumstances. We maintain that employees have to stay home. Ideally, they can work from home if they can. And if they can, they do not have to suffer any sick leave or any of the HR leaves if they're able to continue to do their work from home. And that's both for certificated and classified employees. We're obligated to keep recording and record keeping. We have to work with public health and share documentation and information to them as we get it. And of course, that's part of our reporting process. I think I already mentioned our return to work. You can't come back to work unless you've had 24 hours after your fever has broken. Again, we have a 14-day quarantine rule automatically for people that are considered a close contact. Or if you've had a symptom and you come back cleared and your test has come back, you're able to come back within the 10-day time frame. So that is our CPP process or CPP plan that you're looking at. We also have a checklist that we have to upload. It is a much briefer outline of some of these same certifications. We have to attest that we have stable cohort groups. And this doesn't require us to have all the information about it, but just that when we discuss and have students, we refer to our return to school plan where we have all that information about the cohorts and things we're doing. There's departmental classes, electives, how we plan to do that. And again, remember, we're not bringing back our 712 where the majority of this is, so we don't have that detailed information. Just finishing this off, we've already talked about identifying and tracing. Our physical distancing, we are reporting to the county and the state that we are trying to keep a maximum of 15 students in an area with 6 feet. Those are maximums depending on the square footage. Some square footage will be less, of course, and the number of students that can be in that space, adults, staff, and students, are less than that as well. We talked about training. We're going to have a couple more sessions. It doesn't mention vaccinations in here. It talks about testing of students, testing of staff. When we do a return to work, return to in-person learning, we do have requirements currently about testing students. That will be a requirement for students when they come back, that they will have to understand that they will be weekly testing depending on the tier that they're in. So that's a major component that is new to us that we did not put in the return to school plan, that when we do our revisions, we have to discuss asymptomatic testing. So it's not for symptoms, it's just a generalized testing. We already have that plan for staff. We have to add students to that next plan. There's report casings and communications. And then just a quick note on vaccinations. We are planning to work closely with, one of our parents is Dr. Jordan that works in the area, and we're going to be working on a couple of family nights coming up, employee nights, employee day, explanations of vaccinations and some information around that. So as part of the return, the readiness to come back in person, we're also going to discuss vaccinations and make sure people are comfortable and can answer those questions as much as possible. And so with that, those are my presentations around that, Dr. Kitamura. I'll go to chat or questions and answer and try to answer anything there.
There's one question in the Q&A about face shields.
Right.
Like to answer.
Forgive me. Ms. Whale gave me feedback. I forgot that you need to finish the PowerPoint. Forgive me.
Oh, that's right.
So thank you. So it's part of this rollout plan, our CPP. We're having this communication and consultation with stakeholders. That's part of what we're doing tonight. Briefly, Dr. Kitamura has already kind of outlined the current plan. Again, this is a draft. This is not approved at this point, but because there's funding attached to this, we're trying to do everything we can to make sure we gain those funds if they're available. So we're going through those processes right now. And then we've already kind of discussed, but we're just to reiterate next steps. The first thing we have to do, everyone, is we need to, of course, reduce our spread. We need to get the transmission rates in our community down. So please do everything you can in your area that you do to follow orders. Follow, please, President Biden. Thank you. First time I've had to say that. His 100 days for wearing a mask. Please, we all need to take that very seriously. And we in Santa Rosa schools encourage the same thing. So that's very critical because right now, we have to get the shelter in place orders lifted, and those are due to be reevaluated by February 12th. So please, we have to do everything there. Under the current orders, in the purple tier, we are able to open a K-6 program as Dr. Kidamora is moving forward. We are not able to open a 712 program with the exception of the vulnerable populations. So we describe that our special ed populations, preschool through 22, we are planning to bring cohorts back and work with them. Our foster youth and homeless and our EL students, we are developing those return cohorts for those instructions, and we can do that even in the purple tier. We're going to continue to work with our labor organizations so we can work out those nuances about those negotiations. We are working to work out the testing we described, for both the students and the staff. And we're working on that called the surveillance testing. And then shortly, we are going to be revising and bringing to the board return to school plan 3A, which will kind of incorporate some of these phased in processes and conversations that we're having right now. And so now we're ready. And of course, if you have questions, this is the question email you're welcome to send your questions to, and they'll make our way to whomever they need to go to. And with that, Dr. Kimoto, I will turn it back.
Is it srcsschools.org or is it srcs.k12?
I will have to defer to those smarter than myself.
Okay.
It would be, I believe it's srcs.k12, Steve.
Thank you. I'll change that.
Okay. So we have a question about, and I'm going to just go through these. Will the testing for students be a saliva test?
Currently, as we know, it will be a saliva cheek test, but that could depend on the company and things they have coming forward. We are planning, however, logistically to create a nurse team like an LVN that would administer. So if we do have to do the full nostril, that'll be done by an LVN or school nurse. Ms. Wayhall.
Mind if I add to that? One of the
Yeah.
companies we're looking into, the one that the state suggested, Valencia, it is a nose swab, but it is not a one up here. It's like just around the inside. But there are other companies that do the inside the mouth swab. So it depends on the company we go with.
Thank you for that. The next question is exactly how is vaccination availability creating a delay in the RTS plan? It's not the vaccinations per se, it's really the whole entire package for the governor's Safe Schools for All. If it isn't funded, then it's going to be very difficult to do the things that the plan wants us to do. We calculated just to do the testing for asymptomatic through the fall, because really we're going to need to, I would imagine, and what experts are saying, it's about $10 million. So it's really the difference between the reality of the governor's plan as it relates to school districts. And so he needs to basically get a grip because the timeline is too quick and the requirements are going to be so difficult for schools to achieve. I had a conversation today with President Lyon, and it isn't, I don't want to go for, trying what we can to meet the requirements for the Safe School for All, receive the funding to be able to help offset all of these costs, get kids back into school. However, it has to be doable. It has to be doable from every single end. And, negotiations with SRTA, it is something that just can't be rushed. There's things we have to talk about and get figured out and get on the same page about. So we're moving forward. We're continuing on, and we're going to do the best we can to get some of these things ironed out. What is really the difficult part is the parameters that the governor has set by creating this plan in such a short time without the legislature's support from the get-go. Today, in the legislature, all of the professional organizations came out and really were against the governor's plan in terms of the lack of reality on timeline. That's one of the biggest things. And then some of the components of the plan. So our RTS plan, we're moving forward. We're making the updates. TNL is making the updates. SAFES is making the updates. But I'm going to share this with you. Every day the rules change for Santa Rosa City Schools. I feel like I played tennis. And I feel like I have volleys at me every single minute trying to do, and I have 5 rackets in my hand, trying to figure out how we maneuver all of this. Because in my heart, the most important thing are our kids, and I know they need us in person. I know that. But I also know this. I'm not going to change what I've done since October 2017 in the Tubbs fire. And that is to not ensure the safety of our students and our staff. And I know everybody has a different definition of that. And that's why we have to come together and have a shared and agreed understanding about what that is. And that's what we're going to talk about tomorrow. That's what I'm going to talk about with parents. What one person deems safe, another person doesn't. And we have got to get over that and come to an agreement on what safety is. I have asked the county, I have asked Dr. Mace and Barbie Robinson, the head of the health services, give me a health professional. I prefer one of the doctors. Come here, come to Santa Rosa School, tour the isolation rooms with us, tour the PPE that we have in storage. Look at our checklist, look at our dashboard, go over the data with us together with both of our unions so that there's no question that we are talking about the same thing. So I'm going to continue to push that. We have a meeting next week with three or four of the legislators, and I'm going to continue my same push for, reasonability. Like, we want kids back, we want reasonable processes and protocols, we want guidance, and we want the funds. These cannot be unfunded mandates for school districts. So anyway, okay, I'll get off of that, sorry. So basically the RTS plan is moving forward. These couple of wrinkles though, I don't want to put together something that is incomplete for the board meeting, because we have to have it done by tomorrow morning. So that's one of it. And we won't even have completed our meeting with SRTA yet. So it will come forward in February. It doesn't change the fact that we'll be ready to open at March 1. That I don't need board approval for that. I can, as a superintendent, I have the ability from a programmatic and operational standpoint to say we're going to be ready to open by March 1. Okay. All right. Next question. What is the idea for bringing back vulnerable students? Specifically, would they go for short periods or full time?
Looks like Steve Mazzara's actually just answered that, or I guess.
Oh, okay.
Well, but if you're here, so for special ed populations, I can speak to that. The special ed team, they have a subcommittee with parents and staff that they're working these details out. But theoretically right now, they'd like to come to a 4-day model instead of the cohort AABB. They already have small cohorts. And so they're looking at, say, having a special education class of 12 or less students with one of the special ed teachers and one or more instructional aides. And they would come to the same time frame, the 8 o'clock till 12 o'clock basic time frame. They'd come 4 days a week with a Wednesday off.
And I can speak a little bit to, for the EL populations, we're looking at our current newcomers and newcomers from last year, and it would emulate what has been suggested for the special ed populations.
The next question is the change from job classification to age official? I've heard it from 3 different political sources. I believe that there's going to be an announcement, I understand maybe tomorrow, by the governor Um, um, so we should know more tomorrow. Yes, for the vaccines. I mean, we've already heard the 65-year-old moving up to have vaccinations before educators. And so I think that's kind of a signal that it's going to happen. Caitlin's answering the one about the saliva is a better test in the chat. The next one is for students that stay on distance learning 100%, how are teachers going to toggle between in-person and distance learning?
I'll answer that.
Okay.
They won't. We'll have teachers are also going to be on distance teaching, much as they are now. And so they will have their group and be able to teach the distance kids that way.
And so what that means is that students will be making a choice, or there may be a teacher change because their teacher.
So if you, do you want me to?
Please, thank you, Director Dillon, thank
I
you.
was just gonna say, so we're looking right now at staff that is maybe remote teaching or maybe in person. So if you have selected remote teaching for your child, but their current teacher is going to be providing in-person instruction, it does mean that there is a possibility that their teacher could change. So there will be staff that is providing in person and then different staff providing remote.
Thank you for that. Okay, let's see. It has been 10 months of waiting to get our kids back in school. It is very hard to hear you say it's too fast. It feels terribly slow. Please acknowledge that for us. Yeah, I agree. It's been a long time. It's too fast. I don't know what I was referring to, but for me, it's the changes from the politics and the people that be, not that it's been too fast, or it has been a long time coming for our students and staff to come back. So yeah, it's the changes that I have to, not the changes in the rules. That's what I've been saying. The changes in the rules of the game are just too much, too fast, too often. And it's not fair. It's not fair to our kids. And it's not fair to our staff. And yeah, so what happens if we get to the approved numbers and our numbers change? Are we just going to pull our kids again? So I think that might be in reference to if we're open and kids are back in their cohorts and there is an infection, then what happens? I think that might be the question. And so Caitlin or Steve, do you want to explain what happens when there is 3 or more students or one student that gets 2 students, 3 students, what all that looks like?
Yeah, Caitlin, can you talk about the outbreak side of it?
Sure. So if a cohort is exposed to a positive case, what's going to happen is most likely that cohort is going to be quarantined per public health guidance. And then I assume they would go to distance learning for the duration of their quarantine period, and then be welcomed back once they've fulfilled that. There are thresholds for, schools to shut down based on how many cohorts get shut down in a certain amount of time, due to the number of exposures that are reported.
I don't know if the guidance is the same. There was something where 3 in a cohort, 3 cohorts in a school, 3 schools in a district. Those were the kind of the sequences when this would happen. Is that right?
Yeah, I'm not positive if the number is 3, but there are thresholds set.
And those are all dictated by public health, as you said.
Right.
Thank you.
It was 3 at one point.
It
Again,
was,
that's
yeah.
one of those things that changes. The quarantine days were 14, then it went down to 10. I can't keep track of where it is right now, but I know that your office does all of that. Okay, the next question, this is a good one. Has there been any plans on dealing with the social and mental issues that kids will be going through by coming back to school? Many of these kids have not been around other kids at all for 10 months.
Absolutely. In fact, those of us that have been with us when we came back from our fires, you'll recall that we took days. First of all, when we came back to this, we spent our first time with our staff, our teachers, and work with them to make sure they're in a good place to do that. We're going to be developing exactly that same kind of model. Then we're going to spend time, and we're calling this connection time. So with our school counseling team and our clinical team, we are working with ways that we just spend time connecting back with students and working them slowly back into that pace. So we're very well aware of this. This is a strong subcomponent of social emotional learning. We've had a lot of staff development and area around social emotional learning. We expect to use our experiences from the fires, sadly, but that's given us kind of some mechanisms of how to do that. And then we know that there are going to be lots of situations where in-person counseling is going to be necessary. And so like we would at any time, our clinical staff, our counseling staff, they will be at school available for students that are showing issues and as they try to work through our return, for sure.
And really, don't we have some of those services available now, Steve?
We are, and people access them, in probably not as much as we would have in person, but we do have those available. We're doing that daily. We're doing all our clinical and our counseling services, but of course, it's not the same when you're in person.
How do they access that? How do parents access those services for their children?
You can always start with talking to your site administrator, principal. They have access. There's a referral process and a kind of way that we work that out. Let me give you the our wellness center number. We have a generic number that is any kind of point of contact. You can call, messages are left, and we'll have someone reach out and we'll try to work our way through your services. That number is 890-3827. I don't know if someone can throw that in chat for me, or I will. 890-3827.
Great. Okay. In the AABB cohort, will teachers be working with both in-person and remote students at the same time? I think we answered that one, but let's go ahead and answer that again.
Yeah, and no, they would not. If your child is in the cohort A, your child would come to school on Monday, Tuesday, have in-person instruction with the teacher. And at that time, the cohort B students would be doing kind of asynchronous work or potentially working with a reading teacher remotely, music or PE remotely, but they're not doing a simultaneous.
Thank you. The next one is, and please acknowledge how other districts have successfully implemented hybrid school. Absolutely. I absolutely acknowledge that. In fact, I talked to so many superintendents across the state about how they're doing what they're doing. But I also need the public to acknowledge this. Our county is much different than other counties, and our county leadership has dealt with the pandemic differently than other county leaderships, of which I do not have control. I try to exert whatever I can, my pushiness or whatever you want to call it. But I do need you to understand, I do need the public to understand this. I get it. Other people have been able to open, and other people have been able to have in-person instruction. We unfortunately have just not been able to get the kind of directive guidance that I think should come from the state and the county for Sonoma County. So who will be doing the tracing on site, and how intensive will that tracing be?
So we're already doing intense tracing for primarily staff right now, staff examples. But when students come back, if a student is positive, the contact tracing is not going to be that detailed, because it's if we are following our protocols, they will not have access to other cohorts. It'll be primarily within that cohort. There are siblings that will have to be contacted, and that determination is a consultation with our LVN staff, Ms. Wayhall, and public health. Caitlin, is there something else we should add about how intense contact tracing would be with that? Yeah, it's pretty straightforward. We will, if a student left a cohort and had to go somewhere else on campus, we'd have to follow that up and talk to the parents and talk to the students remotely. That's part of what contact tracing does, and it can take time. But many of these protocols are set to minimize contact, obviously, and then reduce the contact tracing needs.
Okay. The next response is, or question, your only answer regarding secondary return is that we cannot plan because it is too hard. So let me just answer that. It's not too hard to do the work. My staff and I have worked tirelessly on all of this. What is hard is predicting and trying to navigate things that are out of our control. The things that I don't have a say on what's going to happen. That's what's hard. And I tell you, I don't want to put something out there, make a promise to you that I can't keep, right? That I can't do. So that's what's hard. The work itself, not hard. We've done it, we'll continue to do it, and we're dedicated at doing that. The other, you guys are so fast. What was the other part about implementing? I don't know what it was. Something
About
about
looking at other districts, Diane?
yeah, we look at other districts, and we are planning for secondary. The team is working on some ideas that came out in the guidance that I think can be very doable for secondary. And so I want them to do more vetting on it to be sure before, again, I don't want to promise something I can't fulfill to you as a community, but it looks promising for secondary. And so you'll hear more to come on that, more to come. It is not forgotten. It isn't that we're not working on it, we are. Right now, we're doing things in phases. I have an elementary staff, I have a secondary staff. Right now, we're focusing on elementary because those are the first to come into play, should we be able to open. Which goes into the next question. Realistically, if we're not able to return school plan based on all of the factors, at what point date will SRCS just make a decision and say that we will not return in the fall? You know, I just, again, I have to look at the things that are not within my control. We have to go along with the year. And that's kind of why we set a March 1 deadline for being ready to open. Too much in the air, trying to figure out what we're going to, let's just have a date and go for it. We'll be ready. And then what happens after that, that I can't predict, we'll be ready. And if it gets towards the end of the year and it looks like, you know, we're not going to be able to open, then we'll make the decision at that time. But the board, myself, I mean, we're not at this point ready to say anything and stop it until the fall. Let us get to March 1 and be ready and show the public and everyone about our readiness to open, and then determine and then see what's going to happen with the governor's plan, what's going to happen with President Biden and his first 100 days, and some of the mandates, some of the directives I heard from him today. Let's see where all of that goes. So, all right, if a child is in an infected cohort and that group is quarantined, do all the siblings of those children need to be quarantined as well? Good question.
Aileen, are you able to take this?
I was actually just typing to that one. Technically, the siblings would be considered contacts of contact, and they wouldn't be quarantined. That's the guidance you've gotten from public health. But with that being said, if the exposed child was to, their situation was to change and they became ill, then of course the siblings at that point would be considered close contacts. And they would be asked to quarantine.
You cut off on close contacts and then you froze. Open, you froze again.
Oh, sorry. So if the exposed child becomes COVID positive or tests COVID positive, then the siblings would then be considered close contacts, most likely, since they live in the same house, and they would be asked to quarantine within their own family.
Thank you for that. Will the district prioritize making sure secondary students have other opportunities to engage in person with their school communities in a doable cohort, such as extracurriculars, clubs, and sports, since on-site learning is such a remote possibility for 7th through 12th grades?
Well, I'll talk about before we had our shelter in place, we had non-instructional cohorts. We had athletic conditioning, we had clubs, we had FFA, people that were bringing things to work. So we did have to, as part of the shelter in place, we did have to restrict that. When that shelter in place, when that shelter in place is lifted, then we will go back to non-instructional cohorts. And that's a lot of what we're talking about here. We had lots of people coming forward, teachers and classified employees coming forward and creating groups and cohorts for kids and having small cohorts come through and have those events. So those are possible, called non-instructional cohorts. We had some before. We hope to have them shortly, as soon as we get the rates down.
And my Wednesday update has a pretty good description of athletics this last Wednesday, about where we are with athletics and sports and things like that. And the plan that teaching and learning is working on for secondary, coming back for instruction, actual instruction, that would then allow for some of that cohort, extracurricular kinds of things to happen. I am thinking specifically of the seniors again, and what's going to happen with the seniors, and wanting to be able to have them come back and have some activities. So it is all in the planning. We do want to have those activities. So we have not forgotten about our secondary students. Thank you, anonymous attendees. She says, or he says, you are all doing your best. It's a bad situation. The next is, how much heads up will we have on the kids going back? Just that Wednesday update. Just please read that Wednesday update, because that's going to tell you, give you kind of a countdown. If we're getting close, I'll give you a countdown of when kids will get to come back. The vetting has been done by the district since September. I'm not sure what that means, but maybe you can explain what that means a little bit more. If we are ready by March 1st, why can't you push to try? The kids are suffering. That is the requirements by the state. We have to be below, if the governor's plan gets approved, we have to be below 25 cases per 100,000 cases to be able to bring kids back. That's what the governor's plan. So that's what we would have to wait for. Right now, I haven't looked at it today, but the last time I looked at it, have you any of you looked at where we are with our case rate this week? I think it was 45
40.
the last time I looked.
I looked the other night, it was 41.
41, okay. So right now we're at 41, but it will need to be at least 20, it has to be 25 or below. So that's why, and Dr. Mace, the county public health, it won't be there by March 1st, okay? But again, that doesn't mean we cannot prepare. Another district working plan might make more sense rather than waiting for something to be newly created by the governor. As you have admitted, he is silent on the issue of secondary. Okay. Okay, thank you. Yeah, we again, it's not newly created. It's just making sure the numbers will work, what we're looking at. So please know, and I guess it's difficult because you feel that it's been so long, and I get that, and I understand that. And please know, I'm not at all angry. I'm passionate. I'm frustrated, but I'm not frustrated at any of you. I'm frustrated about the things that are not in my control. It just goes against everything in my being not to be able to have our kids being healthy and happy and educated. It's difficult. So for me, it's just difficult. So we are looking at those things, and if you would, I'm sure Dr. Guzman would be happy to talk with you about specifically what those things are, because I think it could work, and they're just smack in the middle of it, like testing it out to see. Okay, I'm still hearing a lot of fear from teachers about returning to school, and I'm worried that this fear is going to drive decision and keep us from reopening. What is SRCS? What is SRCS doing to help teachers feel less fear? That's a great question. In my part of my earlier kind of rant, I guess, and I'm going to repeat this, and that is, I want to bring in a third party. So I've asked public health to provide me either our nurse liaison, I would like to have one of the doctors come in, look at our guidelines, look at our isolation rooms, look at our safety checklist, and SRTA be there, CSEA be there with us and tell us what is not ready, what we need to get ready. And so that it's not an arbitrary decision by us or by any of the teachers union. I think that that's a solution that could really be helpful. Come and tour the warehouse with all the PPE. I've already told staff, let's stop playing around with this. Let's just order the tents, a tent for every site, so that can be the isolation room. Those are approved to be isolation rooms. So, you know, we hear the fear, and I get it. So let's start working together on that. The other one is working together on the dashboard. How we gathered our numbers and getting, in fact, Caitlin has sent it to the Department of Public Health to get verification on the way she gathered those numbers. And so that we can share that with SRTA and CSEA, and even more so, have someone talk with all the groups together about what it means to gather those numbers. So that's the plan, and I'm gonna push for that because it's the only way I think we can alleviate the fear is to bring it out, show what it is appropriate and approved by CDE or not CDE, CDHP, Public Health, to help alleviate the fear. I know schools are getting prepared, but there are still concerns. Will students' temperatures be taken every day? By who? Will there be more staff during recess to make sure students respect distance, social distancing? Can we think of portable hand washing stations? What about lunch?
So I can let my directors, this is part of the work that they're currently working with our principals in all of these different areas to make sure we're addressing, so that there is a coherent and collaborative approach at each of the elementary sites to be able to ensure that we are adhering to all of the rules. Once those are, completed and understood, obviously that'll be shared with families so that there's an understanding about what that's going to look like. I don't know if Kelly or Lisa wants to add to that.
I apologize. I'll defer to Lisa if she's able, just because I was in the middle of typing an answer to a question. I'm sorry.
It's okay. That's okay.
Our principals are working really hard. They're working right now, a majority on getting cohorts really in line. So we know who's coming back and who will be on continue on remote learning. And then they're working on what supplies they're going to need to get everything aligned. So we have common practices. So that is part of what they are doing together as a team.
And Dr. Kimura, I can just say, we've had Boys and Girls Club on campus in North Bay Children's Center. Biella has 4 classrooms. Monroe has 4 classrooms every day where they separate out classrooms and playgrounds. You're on different parts of the playgrounds. You don't have 2 groups. They're not all going to recess at the same time. So it's really articulated about bathroom breaks and recess, and lunches. An example lunches are a grab and go. And that's what we're going to do coming up, is that you're going to get their lunch to take home, and you're going to be on your way out of campus at 12 o'clock. So we've really reduced the amount of kind of overlap, and that's part of getting our information from families, how many are coming back, so we can really get those details. But the way we're currently doing it is they are not sharing equipment. They're not sharing parts of the playground at the same time. It's been working very, very well.
What about the temperature taking, the changes in the regulations about temperature?
Yeah, exactly. Under the latest regulations, there are no requirements for temperature checking. As many of the schools that have opened up that are already doing this, they're not temperature checking when you get dropped off. They're doing the self-assessment. It'll be very important for us to communicate to parents what self-assessment means. There'll be a very kind of a strict check-off that parents have to agree to when they send their kids, that they're going to go through this process, like the Parent Square app and these other electronic means, that they are really taking that seriously, and then if there are symptoms, parents have to be able to pick up their child immediately, and isolate and begin that quarantine process. So those all be kind of requirements that parents that decide to come back will really have to follow carefully.
And Rick, you had talked to me, or I jumped it, but I think, didn't you talk to me about lunches? or no, snacks, breakfast and snacks, food being delivered to classrooms? Or maybe this,
Along with Assistant Superintendent Mazzara, uh, we have worked out with CNS the ability for grab and go and then lunch disbursement for students that aren't on campus certain days of the week. And also looking at ways for delivery or snacks or breakfast time at school sites as well. That would be handled in the same manner of social distancing and taking necessary precautions with supervision to ensure that cohorts stay in cohorts to provide additional safety measures in times when they may not be as contained as they are always in a classroom.
And adding to that very clearly in the guidance is eating outside is going to be a requirement unless weather conditions permit otherwise, separating our cohorts out and spreading themselves out. Those are all things that we've learned from having our support care on classes, and we'll be, kind of following those up as we go through the grades.
Additionally, we're preparing parent handbooks that outline all of these kind of different nuances, like I would say, around this. Beth Berg, our communication coordinator, is working on that, as well as she'll be working with principals on videos to actually show a principal and going through the school to look at, how do we come into school, how do we leave school, all of the different process and procedures. So those are that's what we'll be working on as well for families. Okay, the next one is, but other districts in the county have not suspended those non-instructional activities for secondary students. Does someone want to respond to that? I think into the stay-at-home order, there's supposed some real strict guidelines around what should be happening.
There are very strict guidelines, Diane, and I believe that due to the CIF too, that there has been some conversations about any districts that are not complying with specifically the athletic conditioning. They're being talked to, and that is ceasing to exist.
And my discussion with the 40 superintendents, and particularly the high school superintendents, they are not doing any non-instructional right now. So I don't know if my teams have heard anything different on that.
I have not heard anything. Well, I'm looking at my team from teaching and learning. I don't believe they've heard anything different. So
okay, all right. Athletic conditioning was not really viable. It was very, very limited and restricted, even for runners where the risk of transmission is slight. Is there any response to that?
I think that as we have tried to, and I think the word that we've used a lot throughout all of this is pivot. We pivoted to try to be able to create viable opportunities for our athletic students to be able to condition. Of course, it's none of this has been perfect. And as Assistant Superintendent Mazzara said, that once we're out of the shelter in place, we look forward to being able to go back and having additional teams have that opportunity to have that conditioning.
Okay. Why does the return to school have us missing Wednesday in the week? Why not have cohorts alternate 3-2-2-3? Don't we need more instructional time to make up for losses?
I think that my team too can speak to this, that the professional development opportunities that we have had for every Wednesday have been incredibly helpful to being able to address, as Dr. Kitamura said, all the things that come around the corner, and I think cohesive professional development to be able to address the needs within distance learning. And so that has been a commitment by Santa Rosa City Schools and a commitment by SRTA to be able to allow for a day to be able to have that professional development, and also for an afternoon to be able to check in with students.
Okay. Thank you for your clear and honest communication with the most up-to-date info you have during an ever-changing and impossible situation. Your willingness to bring parents into the conversation is greatly appreciated. Well, I greatly appreciate you coming, and I'm going to set a date for February 18th, so you can put it on your calendars to have you come back for an update like this, so that we can continue on with anything new that's coming about. So that's February 18th, the same time, 5 to 6:30. You stated that we should check with the Wednesday posting to see if kids will go back. So does that mean they would have a 5-day notice starting next Monday? Um, I am able to work with the county that they do modeling and they have a greater ability to predict. And actually, Dr. Mesa's been pretty right on with her, like how many weeks things are out. And so I will signal what I hear from the county about how we're doing with the case rates. You too would be able to see if you go on, and I look at it every day, every night actually, because it changes at night. The County of Sonoma COVID tracking to see where we are on the average cases. And so knowing if the governor's plan goes through that it's going to be 25 or under, or where you see the number coming down, then you know that it's going to be closer to kids coming back. If you see it inching up, it's going to get farther away. So, but professional development should replace, but professional development should replace children's educational time. I think it's a question, but should professional development replace children's educational time? I would
So
like to respond to that.
I can respond to that. And I think Mr. Mazzara can also speak to this a little bit, that of course I hear what you're saying, but an example is that we just got some new mandates from the state around attendance taking, and also what's it called, Mr. Mazzara? It's
Engagement.
engagement. And this is new to us as a district. It's new to the entire state of California. And so we had to spend some of our time during our Wednesdays working through the how-to for our teachers to be able to address this need. Obviously, we are funded on attendance, and so it's important that we are able to do so. And so like most of this throughout this year, it is a balancing act. And so, you know, this is where we are right now. And I will tell you that I think the professional development has been extremely important. And so I don't know if anybody else wants to.
Yeah, Dr. Guzman, not just the PD, of course, but you know, the asynchronous time and the work that's necessary to go into that and do the evaluations of that work. That is a lot of time that we're hearing from our teachers and our labor organizations are bringing that forward. So the asynchronous time does in fact need a lot of teacher time. So that's a lot of that Wednesday as well.
Thank you, Mr. Mazzara. I appreciate that.
And then our final comment. Thank you. I appreciate you all too. I appreciate you all. Thank you. Well, we have a couple more. Asynchronous time should not outweigh in-person time. I am sorry. This is very frustrating. And I'm sorry that it's frustrating. I know that it's difficult, and I can just say that I know our teachers have worked so hard to get up to speed in providing distance learning, you know, in person and asynchronous online, and it hasn't been easy. It has not been easy. The curve, the learning curve for the technology and the applications themselves have been huge, and they have worked so hard to get up to speed. So it's not only delivering their content, it's the way in which they deliver content has flipped upside down. So I'm not trying to make excuses, but I do want to talk about the reality of moving to this kind of teaching and learning, and also acknowledge the frustration about kids not apparently not doing something on Wednesday. However, the Wednesday there should be asynchronous work assigned to your student that they should be working on. We will have this feedback and it will be provided for all to see. So thank you. Okay. It is my understanding that if the students go back, they may not be with their current teachers. Has any thought gone into how these teachers and children will try to build a relationship with a new and possible stranger in this short amount of time? Yeah, it is possible. I am not going to, you know, not be clear about that if we have teachers that are going to stay in remote learning and teachers who are going to do in-person learning, that there could be a change of teachers. And it also depends on the number per grade level. You know, there's a number of factors that could take place. I think your feedback is awesome. That our staff, I would like you to think about how we have students adjust in a situation where their children may be with a different teacher. Elisa, do you want to say something to that? Maybe you've already thought it through.
I was just going to say that our principals, our elementary principals who are amazing, have been thinking about that and actually brought that up and discussed it just a little bit. And that's one of our discussion points. But with that, it piggybacks on what Mr. Mazzara said about having, cell work, having work with, students and making sure that everyone's comfortable. You're not going to go in the first day, no matter if you've had the kids all year. You really want to make sure those relationships are strong, because we know relationships are important with learning.
Thank you for that. I do think that that's something that we should be a part of the plan, though, like put it in writing what we're going to do. So I think that's a great feedback. When students are having to stay, this is a good one too. When students are having to stay home due to quarantine and not the whole class, will they have to switch teachers as well during that time, or will they just be considered absent? They would go to asynchronous work. They would still have their teacher, but they'd go to asynchronous work. That's what my assumption is. Is that correct?
That is correct.
Yeah, they wouldn't change teachers. Yeah.
Unless the entire classroom goes out as a cohort, right? Then it's all,
Would be the
live distance learning. Exactly.
Yeah. Okay, we are at 6:33. I went 3 minutes over time. I want to thank all of you for being here tonight and providing your feedback and being a part of really transparent dialogue. Things I don't necessarily like to hear, but I need to hear them, and things that you may not like to hear, but you have to hear them. And again, please let us get on the same page. Everybody involved, teachers, parents, community members, district staff, all of us. We all want the same thing. So let's get common understanding about a number of things so that we can continue to work together and move forward. Yeah, I'll just leave it at that. I don't want to beat a dead horse. Again, thank you all for being here. We will put this chat, these questions into an FAQ and add it to our return to school FAQ. Thank you so much for the great feedback and questions. Please email questions at srcs.k12 if you have anything else you to provide. And many of you have my email, so I'm available for that as well. So all of you, thank you so much for being here.